Hi, my name is Ashley, and welcome to the Stoned Age. My name is Ashley Brown, and I am the founder and CEO of Cannabis.
Why did you become a part of the cannabis industry?
Well, I started out as a patient. So in 2016, I started using medical cannabis to treat epileptic seizures. I'd been having uncontrolled seizures for over 7 years, and we'd reached kind of the end of the medical road. Doctors really couldn't help me. I was taking a lot of medications. I have 2 young daughters, and I was really unable to care for them or to work. So when a good friend of mine suggested I try CBD oil, I was a little bit hesitant. I said, well, I've smoked pot before, right? We've gotten high and gone to the movies or gone to the zoo. It doesn't seem to help seizures. And she said, no, this is medical cannabis. I really would like you to try it. So I thought I had nothing to lose, and we did. And for the first time in 7 years, I was seizure-free for more than 24 hours. So we cried, because it was the first kind of glimmer of hope we'd had. We rushed home to get a medical prescription. In Canada at the time, there wasn't a lot of guidance, so we were able to get the authorization, but we didn't know what to take or when to take it or how to use it or, you know, any of those ideas. And so I turned to the internet, and there were a lot of people just like me and a lot of information in very informal communities, but I found that women especially were hesitant to ask about those things. So myself and a few other patients decided to form a space for ourselves called Can. And over the course of the last 2 years, we've had an amazing embrace of this community. It numbers in the thousands, and they're all medical cannabis patients seeking to really improve their lives. And there are so many stories just like mine, and very different as well, in all ages and stages and different disease states, and especially with a focus on women's and reproductive health. So they're showing up to support each other, and that's how I ended up kind of on the advocacy side of it.
Nice. So what is the difference between regular cannabis and medical cannabis?
Well, the plant itself...
Sorry.
Go.
Yeah.
So I guess the difference with regular cannabis and, or, you know, adult use or recreational cannabis and medicinal cannabis, in theory, is actually nothing, because the plant itself is the same. But the way that we address it as patients and, you know, as medical cannabis consumers is a little bit different. There's a real desire for symptom control and condition relief. So we're looking at more standardized dosing, understanding what we're using. So instead of intuitively using it, you know, maybe when we want to relax, you're looking to target specific symptoms, everything from inflammation or fatigue or insomnia. There is some argument that all cannabis is medicinal in some way, because people have been seeking relief for thousands of years from it. So I think it's a little bit of, you know, nomenclature. The terms are changing a little bit, and the term therapeutic is used a lot because people, you know, want to find that balance. But in the traditional regulated medical cannabis community, it's also about destigmatization. It legitimizes someone choosing that as medicine when they can go to their doctor and have it authorized and then seek it from a pharmacy. It's reliable and transparent. They know it's tested and is what they say it is, which can be a real challenge otherwise.
Has the historical stigma of cannabis use affected your decision to start using cannabis medically?
I think it influenced me in ways that I didn't understand. I grew up in a very conservative Catholic household. There certainly weren't any drugs being used. That doesn't mean I didn't experiment when I was a youth. But when I, you know, was faced with the opportunity to try it as medicine, I did have some reservations because I didn't perceive it that way. And even once I had the medical authorization and I was using it to control these seizures, which were upwards of 180 a month before medical cannabis, I still was hesitant to share that information with people, including my doctor, who was not comfortable prescribing himself, because I felt that I'd be judged, especially as a woman and a mother, for choosing something that was suspect or maybe unregulated or misunderstood. And it took me a very long time to be comfortable with the fact that this was indeed a medicine that I was using legally and that it was helping me. It really came from the support of the community that really encouraged me to share that, because I understood that it could help other people see that there was such a diverse population of medical cannabis patients. We didn't all look one way, we didn't all have the same story or same illness. So it took time, and I always encourage people to go at their own pace, because it's all right to need to unwind your own feelings about that stigma.
Did your family know?
My family does know, absolutely. In fact, my father, who has, is a British descent, he has been using medical cannabis without a prescription, with just my guidance as his nagging daughter for quite a while. He has type 2 diabetes and neuropathy and several other conditions that are, common in, 75-year-old gentlemen. He has developed a really severe tremor. His doctor is throwing a lot of medications at him, some of which he doesn't want to take. So he visited me on my birthday and was almost unable to get into the house. He was really having trouble with mobility. He was shaking. I've never seen him so bad. And I sat him down at the table and I said, "Okay, Dad, I'm going to go get something." And I went and got my Health Canada authorized vaporizer, so a medical vaporizer, and I loaded up some very high cannabidiol flower, so very little THC, because he's uncomfortable with being intoxicated. He doesn't want to feel that. He was able to take about 5 puffs on the vaporizer. And after about 5 minutes, he started to see a little bit less tremor, and he was sitting there, and we got him a glass of water. And 30 minutes later, I said, "Dad, how are you feeling?" And he was able to pick up the glass of water, and his hand wasn't shaking anymore. So not only do my parents now accept it, they also understand that it has value when other things fail. So I think that comes with time, and women especially really want to encourage their loved ones to use medical cannabis where it's, applicable and in a responsible way.
What was that moment like? When he realized that it worked, when you realized it worked, walk us through it.
So I think for me, I see this, I get to witness this and hear these stories all the time, and yet still in my own kitchen to see my dad, who I love so dearly, and see aging so less than, healthy. It was still astonishing, and it reminded me why I dedicate so much of my life to this, why I leave my children behind, why I work so much, why I volunteer so much, because there are so many people that unless we have these conversations, they will never have that moment of relief. And I think medical cannabis, for a lot of people, even when it's not a magic bullet or a cure, it offers them hope, and they're taking it into their own hands. So for me, that moment was just such a personal realization that we have so much yet we can do.
Is he still struggling with his stigma, or he's gotten over that?
I think for him it was very interesting because he smoked pot, as a teenager, right? So in the 50s and 60s. And so he had some bad experiences. He got too high. So his idea was, I can't even stand the smell of it. And what I've noticed is that the more offerings we have when we say to people, well, there's tinctures, or you can use a vaporizer, you don't have to smoke a joint. He's got arthritis, so there's things that are going to be easier for him. Instead of having to break up the flower or grind it up and roll a joint, he's not going to be able to do that. So even seeing the different methods, I think, helped him understand that. And what I find interesting about his generation now, though, is, and I've had members of my community tell me this, and one of my favorite is they're a couple in their 70s. And I said, "Do you feel uncomfortable talking about it?" They said, "No, we tell our doctors, we tell our friends, because we don't have a reputation to ruin. We're retired. What we're going to get kicked out of work? Our friends are going to isolate us? We've lived our lives. We have every right to, health and success in whatever way we need." So I think that's the unique ability. Once you bring that to people and educate them, it's actually the opposite. They're ambassadors because they've earned the right to speak up.
Yep, they have. How can cannabis help women and issues they face, such as menstrual cramps, morning sickness, stress?
This is definitely something, as somebody who leads a community of of thousands of women. These are topics that are often not discussed in traditional medicine as much as we would like, and there isn't as much research, especially around things like endometriosis and postpartum depression, reproductive health, fibroids, all of it. You know, we're still learning, and women often come to cannabis because they are in so much pain, and their doctors don't know what to do other than offer them hormones or a hysterectomy. And what we're encouraged by is the fact that doctors in Canada are starting to really address this and offer medical cannabis, often before opioids now. So we are seeing gynecologists and obstetricians say, you know, you have this endometriosis, you have PCOS, you have, you know, menstrual pain. This is something you could try. And cannabis in women's bodies is really unique because, you know, we have this endocannabinoid system, and we also have a cycle. So learning how those cannabinoids are affecting us at different times during our cycle is really powerful for women. And I can say, you know, I'm not a scientist and I'm not a medical professional. I can speak to the anecdotal side and say, I am more sensitive at certain times during my cycle to the therapeutic benefits of THC. So my tolerance is lower, my uptake is higher, and women are really unique that way. They find really resourceful ways to use cannabis, including topicals, making their own suppositories, using oils and extracts to do that, so they can have localized relief without the intoxication. So I think that those conversations within communities and online communities especially give women a chance to discuss these things and hear that they're not alone, that there are things that are working, and then really drill down on what they can do and what they feel comfortable doing, because not everybody wants to make their own suppositories. So I think that when it comes to medical cannabis, what's most important to focus on for patients is really validating their right to access and affordability. So we see so many people in our community, 90% of members are underdosing or going without because it's so expensive. And it's not just that the cost is high because the industry has been so heavily regulated. The cost is also high because it's taxed twice in Canada. It's taxed at a federal level, and it's taxed with a sin tax or excise tax now, the same as adult use or recreational cannabis would. So this is adding thousands of dollars, Canadian dollars per year, onto the cost of medical cannabis for people. And insurance companies aren't covering it. So many of our members are making the decision between food and their medical cannabis. And unfortunately, what that does to them and their families is cause them to go back on, you know, pharmaceutically prescribed drugs that have side effects that were undesirable, that they were seeking to get away from, like opioids, like benzodiazepines, drugs that are antidepressants that maybe have negative side effects. So the cost becomes one of the biggest barriers to access. And right from the outset, I think a good practice is to treat it like other medicines. Cover it with insurance, allow it to be dispensed in a way that gives them access and regular supply, and also make sure it's not taxed.
Have you experienced any negative side effects when you use your medical cannabis?
Well, I have been on a lot of medications since I started having seizures, and a lot of them have had side effects. I'd say all of them have had side effects. For me, cannabis has the lowest risk profile. So I was on some drugs that were actually controlling my seizures, but they caused me to lose a lot of weight. I couldn't sleep. I couldn't even care for my children. I couldn't make them a meal because the cognitive impairment was almost as bad as the seizures. So I was looking for something that would allow me to manage my epilepsy, but also to be able to function. And because cannabis is so complex, there are so many options in terms of delivery method, and also ingestion and vaporization. Those are all things that we can kind of tailor to what we need and what effect we need, and minimize the side effects. So I've learned so much from other patients who really learn to mindfully medicate. They're looking for ways to use, you know, conservative amounts of cannabis. Maybe they're taking a capsule, and that capsule has a small dose in it. Maybe they're taking oil and they use it several times a day. It all really depends. And I think there's so many opportunities to kind of say, I don't prefer ingestion because it makes me feel a certain way, but I do like a high CBD flower to vaporize because I can still function, care for my children, and go to work. So it becomes a really individual way to manage the side effects. There have been times where I have used too much oil, not realizing. And I'm a bit of a slow metabolizer, so it can kick in at the most inappropriate and inconvenient times. It has. And sometimes that's okay. You know, if I'm at a piano recital, it's not a terrible thing when the cannabis starts to work, because, you know, the music sounds a bit better, especially when it's coming from 10-year-olds. But at the same time, there are times where I'm on a conference stage and all of a sudden I'll feel that bit of THC kick in, and I'm thinking, okay, this could be interesting. So I think that it can be unpredictable, and we just have to start low and go slow and really learn as much as we can about how to use it responsibly.
What are your thoughts on the evolution of the consumption of cannabis for medicinal purposes? You spoke about some of the different ways you can consume it. So what do you think about that it moved from just taking a tote on a joint?
I'm so excited. We're about to head into legalization 2.0 this fall. So on the Canadian market, what that'll mean is we have access to a variety of products like concentrates, vape pens, tinctures, higher potency products in smaller doses, transdermal patches, inhalers, infused beverages. There are so many opportunities, and what I hear especially from female medical cannabis patients is they're looking for discretion. They're looking to be able to use this in a way that if they choose to be discreet, they can. They're not necessarily wanting to hide it. It's still their medicine, but they want the opportunity to use it in a way that feels, you know, not obtrusive to others and is going to work effectively for them. So I think the evolution of cannabis is really offering people a different way to take in this plant. And I am really personally really excited, because when I think about vape pens and I think about my father, you know, getting so much benefit from this plant but being unable to roll a joint or unable to grind up the cannabis to put it in a vaporizer, these things will offer him that same benefit in a more convenient format. That's something that he can easily access.
Synthetic cannabis versus natural cannabis, which is better? Is medicine, or is there a difference?
I think there's definitely a difference. I look to science and to medicine to explain those things. That being said, I think that we have to be really cautious in how we approach things, because there's a tendency when medical cannabis patients get really good results to really be against anything synthetic or anything pharmaceutical. And the reality is that we still often need those drugs, and they often end up being, you know, more precise and targeted. So I think it's a spectrum. I think that in my own personal experience, the whole plant being in those oils that I'm using, in that flower, we don't know exactly how it's working, but it is. And we're not necessarily always seeing that from the single compounds yet. So right now it's almost more of an art than a science, and I think that as we get there, there'll be a nice harmony between, you know, pharmaceutical and things that can be created in a lab and the plant itself. And as long as we just don't lose sight of where it came from, I think there are opportunities for it to grow into something that, you know, has benefits. So my own experience has been that that the plant itself is a really good jumping off point, and that we have to be careful that we don't take out too many things that may be really supporting, you know, its therapeutic benefits.
Got you. Do you have any tips for anyone that wants to talk to their physician about their family doctor about using medical cannabis to treat their ailments, whether it's pain after an accident, a migraine, or anything like that?
It can be really challenging. I know for myself, my biggest fear was that my doctor was not going to want to see me as a patient anymore. And it took me a good couple weeks to work up the nerve to even sit with him. And I didn't go in very prepared, because I didn't know where to get any of that information. You know, on a daily basis, we talk to women about this, women who are uncomfortable approaching their physicians. It can be a conversation that happens over time. So I think that for, you know, medical cannabis patients in Canada, we're really fortunate to have, you know, cannabinoid physicians who are prescribing. So if a doctor isn't comfortable, they can be referred there. But in the case of someone who only has their family physician as a point of contact, I think that the best thing is to do the research yourself.
Okay.
Not all doctors will know every study that's out there. There's always new information coming every day. So bring some of that to them. Feel comfortable, rehearse it with others, find a community that you can talk to and hear their experiences too.
Given your personal experience on cannabis and how it has helped people with various medical ailments and all that, and just wellness in general, what do you think the impact is going to be like in this new medical cannabis reformation that's coming, a revolution that's coming to the Caribbean?
Well, I am really encouraged by the openness of this country to really pursue this, and I think there's an opportunity to transform people. I know for myself, I was unable to work for over a decade because of my seizures. And that put my family and myself in a situation where we were very limited income. And we were struggling to make ends meet. And for me, medical cannabis gave me back a quality of life, and I was able to find meaningful work doing that. I'm not the exception. There are so many patients now in the industry working on both sides, as a patient, as advocates, and also in paying jobs. And I think that that's something that really can transform society. And it's the perfect blend. When we have people who have the experience of having benefited from the plant, serve the plant by advocating for it, by explaining what people need, by working for these companies, by growing it themselves, you know, that is something that really empowers, you know, an entire country.